Hi everyone, Adnan here. Welcome to another awesome episode of Digital Health on Air. Today I'm super excited to be joined by Dr. Bea Bakshi, the co-founder and CEO at The Signs. Bea and I had a chance to meet each other many, many years ago as she was just starting to enter the US market. So really, really excited to catch up here. But Dr. Bakshi and her team were early adopters in recognizing the potential of AI to combat rising cancer rates, especially with early detection support. And this was before all the AI hype and all the AI buzz. Like, she was really ahead of the curve here. And so super excited to hang today and talk about all your work really at the intersection of cancer detection and AI. And of course, those are both incredibly fast, rapidly evolving, and of course, impactful areas of healthcare. So thank you for joining us.
Thank you for having me.
All right. Well, let's start with really where this all began. So, I think you started to see the signs back in 2017. And
Yeah.
so tell us, like, what were you seeing? What were you experiencing as a physician that really led you to think about cancer detection and, of course, before again, the hype wave, to think about AI as a tool to really help you solve the problems you were looking to solve?
Yeah, absolutely. So back in 2017, prior to that, actually, I was working nationally in digital health policy across the national health system in the UK. And through that role, I did a lot of work on looking at digital health technologies and programs and thinking about, the advent of new products coming to market, data processing, big data sets, AI, and really thinking about how we can use those to improve either care to the patients directly or the way that providers deliver care to patients. And this involved things like legislating interoperability, rolling out electronic prescribing, those types of technologies. And it happened to be that whilst working clinically alongside that role, I was doing a shift in the ER and I met a patient. This was a night shift who had come in floridly jaundiced, so a yellow discoloration of their skin and really unwell. And it transpired that they had been back and forth to see their provider over the course of 6 months, had been reassured that everything was okay, but now sat in front of me very, very unwell. And it was one of those shifts where you spend the entire shift of a kind of 8 to 10 hours with one patient just because of how sick they are. And, through that conversation and time spent with him, you really get a sense to hear the back and forth that this patient experienced about going back to the provider, having symptoms, no resolution, and then sadly ending up here. And after doing some tests and investigations, I had to give him the news that he had pancreatic cancer, most likely that had just disseminated everywhere. And what we know about pancreatic cancer is actually at the later stages, especially, the prognosis is really poor. And it was one of those things of kind of those flash moments for me where I delivered that type of news several times in my career. And typically you get that response from patients to say, why me? Why did I get cancer? Yet this patient was very stoic about it. And his response instead was, why was my cancer diagnosed so late? And as a patient, I did all the right things. I kept going back to the provider, yet the system failed me. And it really stayed with me. And when I kind of followed up what happened to this particular patient after I left him from that night shift, he actually died just 3 weeks later after being diagnosed with cancer. And initially, kind of with my digital hat on in the national role, I said, like, what can we do to solve this problem? Through lots of research and looking at the data, I was really surprised to see that most patients actually had the same experience as my patient did, where they will find a very convoluted way to get diagnosed, constant repeat admissions to see their provider, often a delayed or misdiagnosis. And mainly, actually, it's not necessarily down to the providers because a cancer diagnosis is fraught at the get-go. There's over 100 different types of cancers, loads of different signs and symptoms and risk factors. And uniquely, cancer is a cradle-to-grave disease. It can affect anyone at any time with any combination of symptoms. So I really was obsessed, I'd say, at that initial stage to say, I need to find a solution for this problem. Actually, my first impression wasn't about finding See the Signs. It was about going out there and finding a solution that must already exist to solve this problem for users. And I was super surprised to see that didn't exist and patients actually didn't have any options, which is what led us to start See the Signs.
Obviously, a very hard catalyst to your journey. And of course, we see the same here, kind of put on my Luma hat from like the access side of things. That's just so hard to be able to get into the first place. But once you're in, even then you're saying it's hard and cancer is hard and the providers can be doing all the right things, but there's a missing piece here. So tell us a little bit about like the missing piece. We understand the problem set. We understand you were looking for a solution. The solution didn't exist. Like, what is the solution?
So when I looked at kind of the patient's journey, what I found is that all the innovation and technology was either in diagnostics or therapeutics. And whilst a lot of the approach in the industry up until now has been that diagnostics is the solution to early diagnosis, one of the key things that I found that for me was such an obvious thing, but when I talked to people, I felt it was less obvious, is that for a diagnostic to happen, you still need a human being, a provider, a doctor, or a patient, recognizing that someone needs that diagnostic. Have a bottleneck for either a patient to recognize that they've got signs and symptoms and see a provider, and the provider to recognize, I think you're at risk of this cancer, I'm going to refer you for this diagnostic. So what we end up seeing is that even very expensive diagnostics are just diagnosing cancer still at the later stages very expensively. And I think one thing to say is that, survival, it does have a massive impact. So at the later stages, less than 30% of patients will survive to 5 years. In the early stages, almost 100% of patients will survive to 5 years through early stage detection. And one of the things that for me, especially given the work I was doing in data, etc., was around why aren't we moving really upstream, closer towards the patient, and looking at actually how can we identify patients who are at risk of cancer and then get them into the right diagnostic pathway at the right time. And for me, working in the National Health Service, where we have longitudinal health record data and an integrated health record system, I felt high conviction at the time that there was enough signals in patients' clinical data to help pinpoint if someone is at risk of cancer, the type of cancer, and where to go. So we essentially developed these AI models, which are tumor-specific models that would analyze electronic health record data and patient-reported data. And through that analysis, we could identify if a patient is at risk of cancer today, the cancer type, and also match the patient to the best diagnostic or specialist to rule in or rule out cancer. And that whole kind of episode of care would take less than 60 seconds from assessment to output during the consultation when patients see providers.
Okay, super helpful. I love what you said, right diagnosis at the right time. Like that's critical. So, from your perspective as a primary care physician, as someone who's seeing, you mentioned cradle to grave, every part of our population is seeing cancer rates increase, especially early onset cancers and in younger populations. And so it's hard. Diagnosis is critical. You have a solution today, would see the signs. Like where are you catching people in their journey? And how are patients and providers doing things differently?
Yeah, absolutely. So one of the fundamental things for us, which is really important, is around meeting patients where they are. So in the UK, we have a primary care gateway system where about 90% of all healthcare activity in the UK happens in primary care. So for us, it was really important for us to be able to influence that patient-provider interaction in doing real-time decision support, point of care. And we deployed the technology first through that route. But the second two aspects where we recognize is that actually even through that route, patients are still coming in and booking an appointment with a provider. There are many patients who will sit in the community and just not act on symptoms or not recognize that their symptoms are significant enough. So the other two routes that we launched in the UK is what we call population screening. So we will actually scan the entire EHR of a healthcare system to identify high-risk patients, communicate to them and bring them into the system in order to improve earlier cancer detection. And then the third route is actually going even more upstream to patients within the community in allowing patients to self-assess themselves for cancer risk. And if we deem that they're at risk of cancer, rather than actually even bringing them into the provider setting, we can actually triage them straight to a diagnostic test. And really thinking about how we reduce time to diagnosis and time to treatment in getting these patients into the right pathways. And both of those we've launched in the UK as well, which has been super successful actually in seeing how through these three different methodologies, patient, provider and population, we can pretty much access all patients for cancer risk stratification and early detection. And right now in the UK, we have a patient that goes through our system pretty much every 5 minutes in just kind of like how much volume we've been able to achieve. And really excitingly and really proud, every 22 minutes we diagnose a new patient with cancer through the technology. So you can just see how an AI-based platform approach really has the volume and scale from an impact perspective compared to, I think, point-of-care diagnostic solutions.
That's amazing. I mean, you've built a company of true impact and consequence. So thank you for your leadership there. Look, I think you broke it down perfectly, like really big, difficult, hairy problem and what the solution is and then really how you're looking at it. Our team will laugh, but I always talk about like the triangle offense of the 3 Ps. So in the US, of course, it's patient, provider, payer. but you've broken it down to patient provider population. I think this is a great shift here. You have clear results, impact at scale in the UK across the NHS. You're now also working here in the US. So talk to us a bit about the differences in the healthcare models, like how you think what you do at See the Science, but broadly speaking, innovation and applying things like AI to healthcare problems really differs between your experience in the UK and your experience here in the US.
Yeah, absolutely. The US is a very, very different landscape, definitely from a healthcare perspective. Incentives are very different. And we have to be honest about the fact that healthcare and delivery of healthcare follows incentives, and financial incentives are the biggest motivators, definitely. I think the challenge is that beyond the national screening programs, which cover about 4 cancers, when it comes to all the other cancers, where about 70% of cancer deaths occur, there isn't actually any programs, initiatives, or incentives to improve early detection in those populations. And as such, we've seen probably not so much innovation, but not so much investment in detecting these patients at the earlier stages. But the problem still exists. We have patients being diagnosed in the later stages, very similar to the UK, about half of all patients. We see patients dying from premature death and late stage diagnosis. But actually, we see the additional burden that patients in the UK don't face, which is the out-of-pocket expenses, the very, very high copays, and in many instances, especially with cancer, medical bankruptcy as a result. So not only the healthcare burden of a late disease, but the financial toxicity in the US is significant when it comes to oncology. One of the key challenges that we focused on, especially having our focuses around analysing electronic health record data by means of doing an assessment, where we have pockets of data of patients sitting in different health systems, in different provider practices, essentially around the fragmentation as well, is around addressing this. So our approach actually for our launch, which will be in May 2026, is actually through a direct-to-consumer offering. So whilst we're working with health systems and we're working with payers, we're actually delivering the product directly with patients, in being able to work with them directly, consent patients to accessing their electronic health record data. And through that route, we can be completely vendor agnostic and system agnostic in making sure that we can aggregate data from every single place their data sits, regardless of its Epic, Cerner, or Allscripts. And same with which system their data sits, whether it's the primary care provider or the oncologist or the gynecologist, etc., at the different healthcare services, to truly be able to conduct an integrated assessment on their data and then help navigate patients into an in-network care provider if they're deemed at risk of cancer. So very much the same holistic approach about driving early diagnosis, working with health systems and demonstrating the same clinical utility, but really working with patients directly as a delivery mechanism to be able to run the risk assessment.
Very cool, super clever. So just to simplify it for Adnan's simple brain here, the P you'd circle here in the US is patient because you're going direct to consumer, and the P you've circled in the UK is probably a mix of population and provider. Is that fair?
Yeah, absolutely.
Okay, awesome. You were ahead of the curve. You've been applying AI to a really challenging problem, detection. You know, what do you get excited about? Where you think from a clinical perspective, AI has the most potential?
I'm really, really excited about the fact that AI democratizes access, exceptionally democratizes access, because one of the biggest challenges, I think, when it comes to healthcare inequalities is access and cost. And often that creates huge barriers to the system around affordability. And we see what we call like zip code lotteries about where you live affects outcomes, affordability affects outcomes, and access to care, access to prevention, access to early detection. Whereas AI has the potential to democratize all of these things, but also to personalize all of these things. So a lot of what we talk about, if you think about how early detection or prevention beyond cancer, but just how we approach it generally as a society, is often time-based and interval-based, based on cost to investigate a whole population and so forth. Whereas when you think about an AI system, and what we're really excited about is we can continuously run an assessment looking for cancer risk in your records, so that when your risk changes, we can let you know, rather than waiting for time-based intervals like, oh, we're just going to check your risk every 3 years based on cost, rather than based on what's personal to you. Because what we know with many cancers or many diseases, especially things like ovarian cancer and so forth, is they metastasize in less than 12 months. So again, thinking about how we can be more personalized, but also not introduce cost when we think about personalization, and not introduce cost when we think about accuracy and detection and so forth. because software is significantly cheaper than if you think about a diagnostic approach or having a brick and mortar system where patients have to take time off work, they have to have a car, they have to drive somewhere, etc. All of these things actually create inequities because it means that certain privileged people who have that affordability, have that time, have that capacity, can access those services. Whereas AI has a way to really think about true equity across the system. And also, I think accountability, which is really exciting because you can start actually seeing what people are you able to touch, which demographics do they represent, and are we truly delivering an equitable system, or is it a system that we're only actually servicing a certain proportion within society? So I think the accountability we'll see a lot more with AI compared to actually existing standards of care, where because that data isn't tracked or measured, people aren't held accountable in that way.
Awesome. This has been fantastic. You're dropping hot sound bites and gems all across, but democratize and personalize really stuck with me. And I think that's where all of us who are in the health tech, health IT, digital health space really have an opportunity to deliver more care to more people and to do it in a way that is, of course, more efficient and cheaper. So thank you for what you're doing. We talked about what excites you. On the flip side, talk to me about what worries you, where you're wary as you're applying AI in a clinical environment.
Yeah, really good question. And I think for me, I think why we're really worried about is around misinformation when it comes to healthcare. When you have 1,000 products on the market, all claiming a lot of things, I think it's really hard for patients as well as us as consumers and patients. Every single person is a patient ultimately at some point in their life, knowing what to believe and trust and credibility in healthcare. And I think where we're seeing as agencies, government agencies, etc., is that we need to see more speed and adoption in creating the guardrails for trust and credibility. Obviously, there are good agents out there are bad agents out there, and it's all around how things are deployed with what intentions. AI itself isn't inherently good or bad. And I think that's a really important thing to say, is that we always need to be thinking about, and including we hold ourselves accountable, is that what impact are we having on patients? What are the clinical outcomes? What is the science and what is the evidence? And I think the more we can talk about science and evidence as a way of discriminating and separating products in the market and making sure we're holding all vendors and all suppliers accountable, I think we need to get to that as much as possible, because at the end of the day, all of us are going to be patients and all of us have family members who are consumers of healthcare and we want the best for them. And I think there needs to be more done for patients in order to help improve the clarity around the market, because I think it's really hard as a consumer right now knowing what to trust, what not to trust, what to do, what not to do. And that's causing a lot of chaos, I think, and internal dissonance as well in knowing what to trust and what not to trust. So I think that's something that I think we strive to do really well. From our perspective, we're very founder-led, we're doctor-led, we're very science-driven. But again, it's really important to make sure that we continue to galvanize for that as an industry, that's a really important thing to preserve, is the science within healthcare.
Yeah, no, couldn't agree more, and thank you for just grounding us in kind of the realness. But of course, misinformation is prevalent across every part of our human existence these days, but especially around healthcare, and I'm sure especially around cancer in particular, where there's still so much unknown. Okay, I'm gonna zoom out. Big question, where would you like to see healthcare go next? Be it from the lens of cancer detection, or just broadly speaking, what do you want? What do you get excited about as you look forward into the future?
So I'm super biased because I'm obsessed with healthcare, and I think you often catch me saying that I think healthcare is a human right. People talk about that a lot, and I think in the next decade or so, hopefully we will have reduced the cost, we will have democratized healthcare, and we can really think about leveling the playing field when it comes to life expectancy, when we think about maternal mortality, child mortality, all of these things that we see huge discrepancies for across within nations, but across nations, we should be able to improve that significantly when we think about health literacy as well. So I'm really excited about the opportunity we have that healthcare can become a fundamental human right, and no longer it's the case of as I mentioned before, like a zip code lottery or winners or losers when it comes to healthcare, that actually everyone does well. And there's huge studies to show is that actually when populations do well in healthcare, economies thrive, people do better, it's better for the country, etc. So I think in that way we should see a huge shift in the next 10 years from where we are today.
Awesome. Bea, this has been fantastic. For our listeners who are joining from the UK, hopefully they're already benefiting from your work. And for our listeners here in the US, we eagerly await the May 26th drop, and that'll be consumer led. So we'll be able to find, I'm assuming, see the signs in an app store near you. Is that right?
Absolutely. And we are kind of in December dropping a wait list as well. So if anyone would like to be the first kind of to sign up and give us feedback, please do.
Okay, well, we will make sure that hot link pops up here on the screen and folks can click to sign up for the wait list. Bea, this has been awesome. Thank you for helping us just get smarter on the challenges of cancer detection, the impact that you're already making in the UK, and of course the promise of your core technology and platform. And hey, look, we didn't have an official AI, how many times you used the word AI tracker, but it was very little, which is quite refreshing, because on the flip side, there's people who use that word probably 15 times in a sentence and aren't really doing much of anything. You probably used it 2 or 3 times in total. And of course, you're already using that technology to solve very, very meaningful problems. So thank you, Bea.
Thank you so much, Harvey. Thank you, Adnan.
Okay, we'll see you guys.